entered the patient's room. I've checked the chart and the door. She's not on any isolation or fall precautions. I'm performing hand hygiene. And I've checked the environment. There are no environmental or safety hazards. Hi, my name is Evita. I'm going to be your nurse today. And can you tell me your name and date of birth, please?
Marianne Carlson, 12/26/72.
Thank you. And can you tell me where you are?
I'm at Johnson Willis Hospital.
And today's date?
Today is Saturday, December 3rd.
Thank you. And I'm going to be performing a head-to-toe assessment, okay? And the first thing I'm going to do is check for pain. So on a scale of 0 to 10, 0 being no pain and 10 being the worst pain you've ever felt, what would you rate your pain today?
It's a 0.
Okay, good. The facial expression is appropriate for the situation, and she is sitting upright in bed. Her skin is moist, pink, and dry, and she's got brisk skin turgor. There are no lesions or areas of breakdown noted. She is not at a risk for skin breakdown as she is not on bed rest. Do you have any, or have you ever had any difficulty hearing?
No.
Okay, perfect. And so now we're going to move on to, excuse me, she also appears to have good hygiene. So we're going to move on to the neurologic exam. I'm going to just look in your eyes with the light, if you can just look straight ahead for me. Perfect. And so she's got perola, and her pupils are 3 millimeters. Can you close your eyes for me? Did you feel that? You can open your eyes. And was it dull or sharp?
Dull.
Thank you. And her motor and verbal responses are equal and appropriate. And can you squeeze my hands? Perfect. Her grips are equal bilaterally. And can you push? Okay. And pull. Perfect. And then push my hands and push them again. And upper and lower extremity strength is equal bilaterally. She communicates appropriately, logically, and realistically. The next I'm going to do is her respiratory assessment. She's not on oxygen, but if she was on oxygen, I would check for the orders, the tubing placement, and for any other environmental hazards. So I'm going to check her breathing is non-labored, and I'm going to auscultate her breath sounds. Can you sit up for me? Mm-hmm. Take a deep breath. Okay, her lung sounds are clear bilaterally, anteriorly, and posteriorly. Can you take a deep breath? And then can you cough? And there's no mucus noted, so there is none to be evaluated. She is not on an incentive spirometer, and so there's no teaching that needs to be done. Can you take a drink of water for me?
Sure.
Thank you. It is also noted that her swallowing is intact. Now I'm going to perform the cardiovascular assessment. I'm going to auscultate the rhythm at the apex. It's a regular rate and rhythm, no murmurs noted, and now I'm going to listen to heart sounds at the apical, pulmonic, Erb's point, tricuspid, and mitral valve. And now I'm going to listen again with the bell. S1 and S2 her. She's got a regular rate and rhythm, and no murmurs noted. I'm also going to now simultaneously assess her apical pulse along with her radial pulse. Okay, so I assess for 1 minute, and the rate is regular, and there are no deficits noted. And now I'm going to look at her and check to see if there's any pretibial edema. And there's no edema present. Now I'm going to check post-tibial pulses. Okay, pulses are 2+ bilaterally. Now I'm going to check the dorsalis pedis pulses. And the pulses are 2+ bilaterally. Her capillary refill is under 3. There is no IV, so there is no need to assess IV site. And now we're going to do the abdominal assessment. If you can slide down for me. Okay. The contour of her abdomen is flat. I'm going to auscultate the vowel sounds in all 4 quadrants. Vowel sounds are active in all 4 quadrants, and now I'm going to perform light palpation. Any tenderness or pain noted?
No.
Okay, good. And you can sit up for me. Thank you. And when was your last bowel movement?
This morning.
Okay. And how are you tolerating your diet well?
Yes.
Okay, good. And can you tell me, do you urinate regularly?
Yes.
And what is the color of your urine?
Clear yellow.
Okay. And does it have an odor?
No.
Good. And do you notice that you're passing gas okay?
Mhm.
Okay, perfect. Thank you. So the patient is not on bed rest, and she's not a fall risk. There are no STDs, TEDs, or any foot pumps in place. She does not need assistance with transferring as she ambulates independently. So now I'm going to return her bed back into the lowest position, going to ensure that the brakes are on and that her call bell is within reach, and the appropriate side rails are up, and I'm going to document my assessment and findings.